Disclaimer: we are not doctors, medical officials, or certified representatives. This video is for informational purposes only, designed to educate you on the basics of CPR, which can help save lives in emergencies. To become fully trained and certified in CPR, we strongly recommend enrolling in a recognized medical course at your nearest training center. Imagine you're walking down the street, and suddenly, someone collapses in front of you. They're not breathing, and their heart has stopped. What would you do? Would you panic? Would you freeze? Or would you take action and possibly save a life? Welcome to today's life-saving guide on how to perform CPR, cardiopulmonary resuscitation. Whether it's a family member, a friend, or even a stranger, knowing CPR can be the difference between life and death. So stay with us as we break it down step by step. Before performing CPR, you must quickly assess if the person actually needs it. Here's what to do.
Your safety is just as important. Before approaching, scan the surroundings. Make sure it's safe to help. Tap their shoulders firmly. Shout loudly, "Are you okay?" If they don't respond, move to the next step. If they're not breathing or only gasping for air, it's a sign that their heart has stopped. They need CPR immediately. If you're trained, check for a pulse for no more than 10 seconds. If there's no pulse or you're unsure, start CPR. Call emergency services right away. If others are around, assign someone to call 911 while you begin CPR. If an automated external defibrillator, or AED, is nearby, have someone bring it to you.
Now, let's get to the most critical part, chest compressions. This keeps blood flowing to the brain and vital organs.
Make sure the person is lying on their back on a firm surface. Kneel beside them. Place the heel of one hand on the center of the chest, right between the nipples. Put your other hand on top, interlocking your fingers. Keep your arms straight and position your shoulders directly above your hands. Now push hard and fast. Compress at least 2 inches deep for adults and at a rate of 100 to 120 beats per minute. A good rhythm to follow is the beat of the song "Stayin' Alive" by the Bee Gees. Allow the chest to fully rise between compressions. Do not stop unless help arrives or the person starts breathing.
Step 3, providing rescue breaths if trained.
If you're trained, you can add rescue breaths after every 30 compressions. Open the airway. Use the head tilt, chin lift method to open the airway. Give 2 breaths. Pinch their nose, make a complete seal over their mouth, and give 1 breath. Watch for chest rise. If it doesn't, readjust the head and try again. Give a second breath, then go back to chest compressions. Repeat the cycle. 30 compressions, 2 breaths.
Step 4, defibrillation and how to use a defibrillator.
In a cardiac emergency, time is everything. If someone's heart has stopped beating, CPR keeps blood flowing, but sometimes a shock is needed to restart the heart. This is where a defibrillator comes in. What is a defibrillator? A defibrillator is a life-saving device that delivers an electric shock to the heart. It works by stopping an abnormal heart rhythm and giving the heart a chance to restart in a normal pattern. There are 2 main types of defibrillators. Medical-grade defibrillators used by professionals in hospitals and ambulances, and AEDs, Automated External Defibrillators, which are designed for public use, even by people with no medical training. Where can you find an AED? AEDs are commonly placed in public spaces where large crowds gather. Look for them in locations like airports and train stations, shopping malls, schools and universities, gyms and sports stadiums, workplaces and offices, community centers, and theaters. They are usually inside a bright-colored case mounted on a wall with clear signage. How to use an AED, step by step. If an AED is available, use it as soon as possible. The device itself will give voice instructions, guiding you step by step. Here's how to use it. Step 1, turn it on. Turn the AED on. It may have a power button or simply open when you lift the lid. Once on, it will start giving voice commands. Step 2, expose the chest and attach the pads. Remove any clothing from the chest. If the person is wet, dry their chest before attaching the pads. Now, take the electrode pads and place them as shown on the diagram. 1 pad goes on the upper right side of the chest, just below the collarbone. The other pad goes on the lower left side, below the armpit. For children, some AEDs come with smaller pads or a child mode setting. Step 3, let the AED analyze the heart rhythm. Once the pads are in place, the AED will analyze the heart's rhythm automatically. Make sure no one is touching the person during this time. Step 4, deliver the shock if advised. If the AED determines that a shock is needed, it will instruct you to press the shock button. Before pressing it, make sure everyone is clear of the person. Step 5, continue CPR and follow the AED's instructions. Once the shock is delivered, the AED will tell you to continue CPR. Resume chest compressions immediately. The AED will monitor the heart and may advise another shock if necessary. Continue CPR until emergency medical services arrive.
Important AED safety tips.
Here are a few safety tips when using an AED. Never use an AED on a wet person. Move them to a dry surface first. Do not place pads over a pacemaker or implanted defibrillator. Look for a small lump under the skin. Remove any metal jewelry or medication patches from the chest area before applying the pads. If the person has a very hairy chest, shave the area first. Some AEDs come with a razor for this reason. Defibrillators are powerful life-saving tools, and the best part? They're designed for anyone to use, even without medical training. If you ever find yourself in an emergency where someone isn't breathing, don't hesitate. Grab an AED, follow the instructions, and take action. You could save a life. Spread this knowledge, share this video, and encourage your workplace or community to have accessible AEDs. Being prepared today could make all the difference tomorrow.
CPR is a skill that can save lives. If you've never taken a CPR course, consider getting certified. The more people who know CPR, the more lives we can save together. If you found this video helpful, share it with others. You never know whose life it might help save. Stay safe, stay prepared, and we'll see you in the next one.